Hello, everyone, and welcome to yet another of our COVID-19 community updates here for the City of Brandon. Once again, you're going to have myself, Mayor Rick Crest, along with our Emergency Manager, Mr. Brian Kays, providing you with a little more information and certainly some great reminders as we continue to deal with the COVID-19 virus. Certainly, Prairie Mountain Health and the City of Brandon specifically has had an uptick in cases that public health officials are contending with. And now that we have more granular information being provided publicly by public health, it does make it a little easier to determine what is going on here specifically in Brandon. We've learned over the last number of days that not all cases reported in Prairie Mountain Health are indeed from Brandon. Well, the last several days were modest with some 3s and 5s and a little more modest number of cases. Today there was about 20. So unfortunate to hear that. Dr. Roussin does advise that most of these continue to be related to the cluster and to known contacts, and so not a lot of community transmission, and that part of it is certainly encouraging. But we are reminded that this virus has not left any region, city, town, or rural area. There are cases popping up in every part of this province, even more lightly populated areas of Prairie Mountain Health nearby us as well. And therefore, it is so imperative that every one of us refocus on the fundamental personal procedures each of us must take. So Brian will remind us of those in a minute. But I will take a moment to comment about masks that have become a very important addition to Dr. Roussin's prescription to all of us. There's a great benefit to using a mask when physical distancing is precarious, difficult to do, such as indoor public places, such as stores and businesses and other busy public places such as that. So you all are reminded that wearing a mask is a good thing to do, and that is added to the other personal protection measures that we must all take. None of those are mandated or part of law. They've just been part of our general practices that public health has instilled in us from the very beginning of it, and now masks are heavily added to that list. I announced on Thursday's broadcast of a very positive public campaign led by Maple Leaf Foods, of course a very prominent business in our communities, that will see the contribution and distribution of thousands of free masks to Brandon residents and visitors. The final details to do so properly and safely are just being finalized by Maple Leaf and will be announced in the next day or so. So please stay tuned for this very public and positive effort being provided by the good folks at Maple Leaf Foods. Now a word about stigma. Dr. Roussin and team have, from the very beginning of the pandemic, have been very vocal that stigma and blaming and shaming have no place in the pandemic response. It makes things more difficult for public health to deal with the virus. It discourages people from getting tested or providing proper contact tracing and so on. So it pains me to have been told that some Brandon residents have apparently been refused service in some Winnipeg establishments just lately. I'm hoping this misguided strategy is very isolated and ceases immediately. We are friendly Manitoba, and these incidents are certainly not in keeping with our reputation or our good nature. So it was painful to hear about that. I'm hoping that it's isolated and we won't see any more of that. Now, on to Mr. Brian Kays for an update from our emergency manager.
Well, thank you, Your Worship. 94 new cases in Manitoba since Friday, Your Worship. Of those, Brandon had 36. Active cases in the province as a whole now total 232. Our total now sits at 86 active and 64 people who have recovered. Good news in this is that many people have or are in the process of recovering. But these overall results continue to put us on notice COVID-19 is still lurking in all parts of the province. And lurking is a good word for. The wind was a torrent of darkness among the gusty trees. The moon was a ghostly galleon tossed upon cloudy seas. The road was a ribbon of moonlight over the purple space. And COVID-19 was waiting, COVID-19 was waiting for a ride on your hand to your face. Well, there's a little highwayman for you, Your Worship, with my apologies to Alfred Knowles. Have I got your attention yet? The issue is close contact, and when you are close to people, touching them, you're also likely to touch your face. But also think of how you are sharing each other's breath droplets, and think about the bad breath that you are breathing in. You're doing nothing but increasing the likelihood that you are a perfect candidate to spread the virus and become ill yourself. The more people you do this with, the more likely you are to get sick. So stop it. And when we all stop it, we'll stop the spread of the virus. Wearing masks is a good decision anytime you cannot be certain that you can stay 2 meters away from others. The City of Brandon encourages everyone to wear masks or be prepared to put on a mask when they are unable to maintain a 2-meter separation. But remember, masks are not a silver bullet. They are just one more tool to manage this outbreak. So when you choose to wear a mask, clean your hands before you touch the mask. And then, as hard as it is to do, keep your hands off of the mask. Pulling the mask down below your nose only serves to contaminate the mask with whatever stuff is coming out of your nose. And then when you put the mask back up over your nose, you're moving that contamination very close to your eyes. Pay attention to what you are doing. Wear a mask when you cannot maintain 2 meters of separation from others, and wear one when you are meeting vulnerable people. So that's someone with a pre-existing health issue, or perhaps an elderly relative. Wash your hands, put on a mask, and still stay 2 meters away. We need to be consistent and unrelenting in how we protect ourselves, how we protect our families, and how we behave when we are at work, and how we behave when we are in the community. This is a group project where everyone has to work together. We've seen many times where one person's error in judgment leads to many ill friends and neighbors, and perhaps most distressing is the illness that gets inflicted on strangers. We rely on you to look after yourself and your family. The government or health officials can't do it without your help. And it's pretty easy to help. Here's how. Frequently wash and dry your hands. Keep your hands to yourself. Don't touch things. Do not touch your face or anyone else's face. Cover your cough or sneeze. Be kind and watch out for each other. And if you're even mildly ill with COVID-19 symptoms, stay indoors and keep to yourself. If you meet with people, do it out of doors and stay out of doors. You're allowed groups of up to 100 people if they can maintain a distance of 2 meters from one another. If you're not sure, clean your hands and put on a mask. If you meet people indoors, meet in groups of less than 50, as long as they can social distance. If you're not sure, wash your hands, put on a mask. Use physical distancing, so stay 2 meters apart. Continue to disinfect everything you touch and do not share personal things with other people. Keep your smartphone to yourself. Wear a mask when you cannot be certain you can maintain 2 meters of separation from others or when you are with vulnerable people. If you're returning from travel outside of Canada, you must quarantine for 14 days. This is a requirement of the federal government. If you're coming to Manitoba from points in Canada east of Terrace Bay, Ontario, use the provincial isolation guidelines, which also require you to isolate for 14 days. Protect your community using reliable sources of information, including manitoba.ca/COVID-19. Finally, do not call 911 unless it is an emergency. Please, work with us, do your part, and we will do ours. Thank you, Your Worship.
Thank you very much once again, Brian, and we always certainly do appreciate when you break into a little bit of theater to help get this very important information home, and the Highwayman is one of my favorites, so thanks very much for drawing on that one. I didn't from the outset, by the way, if you certainly noticed that I'm not in my usual seat in council chambers with the Queen's picture over my shoulder. I couldn't be at City Hall in time for the broadcast, so through the marvels of the modern technology that we have, I'm able to do it online, so that's why I look a little different, but we're getting the message out there. So again, thank you very much, especially Brian, for re-emphasizing the use of the mask. I'm certainly enjoying to see such a large uptake of masks throughout the community. I've personally been in a store for the last week or so not wearing a mask myself, and well, there's many of the certainly disposable masks. It's quite interesting to see all of the mastery that's gone into some of the washable masks. I'm sporting the Blue Bombers mask, which is much to the chagrin of people who support other CFL teams. But it's great to see many out there, some beautiful First Nations creation of masks I've seen. So, you know, those that can get those and those that can. So it's great to really be personalizing these masks. So Brian and I will be back for another of our community updates on Thursday, August 20th. Again, we roll these out at 4 p.m. So again, stay tuned and keep abreast of local information. We certainly have had some great information coming out. We had Dr. Amy Fracoda and the manager of the 7th Street Access Center with this last broadcast and provided a really deep amount of local information. So in the meantime, until Thursday, stay safe, stay vigilant with all of your personal precautions, and be kind to one another. Thank you very much.